Pediatrics include patients from neonate to adolescent, ranging from the age of 0 to 16 years old. Taking a pediatric history can be daunting if you're not accustomed to working with children. If you're new to this channel, hi, my name is Dr. Erwin. I help high performers create habits to lead a happy and successful life. I publish new video every Thursday on the subject of happiness and success. If you don't want to miss any future video, don't forget to subscribe and ring the bell. Today we're going to look at pediatric history. Children are resilient and tend to compensate when they are ill. However, they can decompensate and deteriorate rapidly. Identifying the age of a child is key in pediatric history. Let's take a look at the nomenclature. A neonate is a child age under 28 days. An infant is a child age between 1 and 12 months. A toddler is a child age between 1 and 3 years old. A preschooler is a young child between age 3 to 5 years old. A child of school age is between 5 to 12 years old. And lastly, an adolescent is between the age of 13 to 17 years old, also known as teenagers. The child is generally accompanied by a parent or a carer. In very young children who do not speak, the history is taken through the parent. It is important to be aware that parent with a sick young child might be anxious. When you take a history, be empathetic. In older children, the history can be taken directly from them. Some children are shy and might be embarrassed to talk. It's important to be friendly and engage with the child early on. Children like to play. Do not ignore the child and talk only to the parent. Greet the child, be playful if appropriate, interact with the child and address your questions to the child who is your patient. Remember, the child is your patient and not the parent. Communication is key to gather a good pediatric history. The child might not be able to answer all your questions, so you could encourage the parent to pitch in the history. It is vital to get the full account of the problem from both the child and the parent if possible. With older teenagers, maintaining autonomy without offending the parent can be tricky. Sometimes teenagers might feel uncomfortable to share personal information if their parents are in the room. It might be necessary to invite parent to leave to achieve privacy. The teenager might be more at ease to answer personal questions about sexual behavior, smoking, or alcohol. A pediatric history consists of specific elements not generally explored in a traditional medical history. First thing first, you need to introduce yourself and gain permission to take a history from the child and parent as appropriate. If your patient is a newborn, you might want to congratulate the parents before you jump in the history. Start with an open question to establish the reason or reasons why the parent brought the child. Can you think of any question you would ask to start the conversation? You might say, "What brings you today? How can I help?" Make sure that you know who is accompanying the patient. You might ask a child, "Who's with you today?" The parent or the patient might start telling you about the presenting complaint, the symptom that brought the patient in. The next step is to explore the history of presenting complaint. Your aim is to get a chronological order of how the symptoms started, how it's developed, and whether it's been changed. So you might want to ask, when did the problem start? How did it develop? Has it changed? Common symptoms in pediatric include fever, breathlessness, rash, coryzal symptoms, runny nose and sore throat, pain, and seizure. It's important to identify any aggravating factors or relieving factors. Always ask whether there's been any previous episodes or similar illness. Let's go through some examples. Let's say you have a child who is 2 years old presenting with fever and rash. What do you want to know? You want to know when did the fever start? How long has the fever been going? How high has the temperature been? Parents tend to measure temperature at home and they tell you the temperature was 38.5. If a child presents with fever for 5 consecutive days, it's important that you think about Kawasaki disease. With fever, you need to ask whether the patient has been taking any Calpol, paracetamol for children. If the Calpol has been helping with lowering the temperature, you want to know the focus of fever. Could it be an infection? Could it be an upper respiratory tract infection, a urinary tract infection? So you need to be asking questions to help you make a diagnosis. Rash is common in children. With the rash, you need to know how long has this been going on, whether the rash has spread, whether the child has any allergies, any recent change in fabrics or lotion. Some parents may have performed the glass test where They press on the skin to check whether the rash disappears or not. If the rash doesn't fade when you apply pressure, it is a non-blanching rash. A non-blanching rash can be a sign of something more serious. Infection is a common reason why children become sick. It is important to inquire whether the patient has been in contact with anybody with similar illness or any of the siblings who have been sick recently. Also check whether there has been any recent overseas travel. Has a child been kept from going to nursery or school? Sometimes there can be an outbreak at the nursery or school. Some children may present with seizure. This presentation is frightening for parents, especially if it's the first time. It's important that you understand the history and take a history of the seizure, pre-seizure, during the seizure, and post-seizure. Make sure you assess for meningitis or encephalitis, which are both life-threatening conditions. Feeding history is important in pediatrics. You want to know the intake of food or feed, whether the child is bottle-fed or breastfed, whether the child is taking oral fluid. If the child is being bottle-fed, is it formula? Which one is it? How much is the child being fed? How frequently? If a child is feeding less than 50% of the usual feed, then you might want to know whether there's anything else going on. If a child is feeding, then you would expect the child to pass urine and to poo. You need to ask questions about whether the child has wet nappies and dirty nappies. If the child is toilet trained, then you could ask whether the child is going for a wee normally, whether there's any other problem when they're passing wee. With bowel motion, sometimes children can become loose and have diarrhea or constipated, so make sure that you explore bowel habits. It is vital to get the idea, concern, and expectation in a pediatric history. As you have two persons, you have the patient and the parent. Make sure that you ask both of them if appropriate. Parental concern in pediatrics is taken seriously. Make sure that you inquire whether the parent has any concern and that you address their concern. The next section is birth history. The way I remember it is in a chronological order, starting with antenatal, birth, and postnatal. You want to know about the obstetric history of the mom, whether there has been any complication, whether the scan was normal, whether there's been any problem in blood sugar control or high blood pressure. So this is what you would cover in the antenatal part of the birth history. The next part is gestation. You need to know whether the child is premature or full term. 37 to 40 weeks is considered full term babies. What is a birth weight? Normal birth weight ranges between 2.5 to 4.5 kilograms. Ask about the mode of delivery. Was it normal vaginal delivery? Was it forceps or ventouse? Or was it an emergency C-section? Was there any complication at birth? Did the child pass meconium within 24 hours? Was there any problem with jaundice, fever? Did the child have to stay in special care baby unit postnatally? Or was there any problem establishing feed? So these are the questions that you need to ask in the birth history. The next section is developmental history. This is key in pediatrics. You need to know about the development of a child, whether the child is attaining the milestone on time or whether there's any delay in the development. The way to remember about asking these questions is GFSS, so gross motor, fine motor, and vision, speech and hearing, and social. A child normally smiles by 6 weeks, will sit by 9 months, start speaking first words by 18 months, start walking by 18 months. Make sure you study the normal developmental milestone. This is very important, especially if you're assessing a child with cerebral palsy or who has any problem with their development. The next section is growth history. This is where you explore whether the child is gaining weight and growing normally. In the UK, children have a red book when they're born, and parents will carry this red book at consultation, so you can have a look in the red book whether the child is growing normally, and you can plot on the graph to see which centile they're following. Next section is post-medical history. You need to know whether the child has been seen previously in hospital, in A&E, or by the GP, whether the child has a medical problem that requires regular visits to the doctor. A key element of the pediatric history is to ask about vaccination, whether the child has been vaccinated and up to date with their immunization. If the child has not been immunized, then inquire what's the reason for that. The next section is drug and allergies. You need to ask whether the patient is taking regular medication, any over-the-counter medication, Calpol, Nurofen, or supplements. Also ask about allergies, whether the child has any allergic reaction to nuts, to some medications, antibiotics, and if they do have allergies, then ask what sort of reaction do they get when they're exposed to these allergens. Some may have severe reactions such as rash and swelling, in which case you need to make sure that's documented in their notes and avoid these allergens. In family history, you want to know who's living with the child at home, whether there are any siblings, whether there's any medical conditions that run in the family. You might want to draw a family tree. Social history is important because it gives you an indication of the environment and the conditions in which the child is living. Ask about parental occupation. Ask about smoking status of parents or anybody living with the child, whether the health visitors have been involved. Ask whether there has been any involvement with social services. How is the child doing at nursery or school? How is the child finding school? Has there been any problem raised at school? Is there any bullying problems? Because bullying is quite common at school and it can affect the child's health. Other question you might want to ask in social history is whether the child has any hobbies, what do they enjoy doing, whether the child is exposed to any pets. Last but not least, you need to cover the systems review. Some doctors prefer to do the systems review after the history of presenting complaint. Others prefer to do it at the end. There's no right or wrong here, whichever works for you. A systems review will allow you to make sure that you don't miss anything in particular in other systems. Generally, you would ask about fever, about behavior, any lethargy, any drowsiness, rashes. Then you would proceed by asking questions for specific systems, such as cardiorespiratory. Does the child have any cough, any noisy breathing? Parents might tell you that they think the child is wheezy, have stridor, or have a crook barking cough, or is having some problem with their breathing and there's discoloration of the skin. So you need to ask this question in the systems review. Following the cardiorespiratory system, ask about the gastrointestinal system, whether the child has any abdominal pain, any diarrhea, constipation, any vomiting, any reflux. ENT review is important in pediatrics. Ask whether the child had any sore throat, any snoring, noisy breathing, or any ear aches. You might also want to ask about the genitourinary system, whether the child had any burning when they're passing wee, whether there have been any problem where they're going more frequently, or they're wetting the bed. Last but not least, ask about the neuromuscular system, whether the child has any headaches, any abnormal movements, any seizures or fits. As you can gather, the pediatric history contains a lot of sections that you would not otherwise explore in a medical history. Key elements to cover in pediatric history include feeding history, birth history, developmental history, graft history, immunization history, and family history. If you need to go back and watch this video again to make sure that you understand which sections that you need to go through, then go back and watch it again. I hope you find this video useful. Let me know down in the comment section if you have any suggestions for future videos. If you like this video, subscribe to my channel where I'm sharing more great tips just like these every week. Thanks so much for watching. Take care everybody. See you in the next video.